in all the episodes that you have done, you have always spoken very highly of prevention of these injuries.
Absolutely.
And for all our budding athletes who are taking up running, can you share with them some preventive techniques so that they don't have to go through all this trauma of injuries?
Of course. And I wasn't sure you would ask that question, and you did. So as they say, prevention is better than cure. So there are many things runners can do to prevent knee pain, shin pain, ankle injuries, and all of that. And if they follow these tips which I'm going to give now, I'm sure most of the times the knee pain, the ankle pain, the shin pain can be prevented. So first of all, proper warming up and cooling down. So before starting your run, suppose you are training for a marathon, just initially do 5-10 minutes of warm-up exercises, and when you finish the run, just suddenly don't go back home or don't start your work or what is your next activity. Just relax, do some stretching and cool down. If there's a possibility of some kind of an ice bath, when you get to some serious training, ice bath cooling down I've found is really very good. So that is about warming up and cooling down. The second is slowly progress. You may be running a 42 kilometers marathon. So don't start on day one running up to 30-35 kilometers. Slowly progress. Today you do 10, next day you do 15, 20, and then gradually in probably 4 or to 6 weeks time, you go to your final destination of 42 kilometers, or some of you run half marathon, whatever it may be. So slow progression of your target. The third is simultaneously just practicing running is not enough. You have to train your own body as a whole. So of course, keeping a cool mind, keeping a proper sharp mind is important. In addition, training your other muscles. So strength training, I feel, is very, very important for running. So changing your activities and then doing something different instead of running that day. So what different things can you do? Number one is swimming. Because swimming, you don't put weight. There is no impact. So swimming is good. Cycling you can do. Cycling is a very good activity as a cross activity from your daily training things. And then going to the gym, doing the strengthening and, making sure all your muscles, not only the lower limb muscles, but also the upper limb muscles are strong enough to support your 21 or 42 kilometers marathon. The next and most important thing I would say is footwear. And many times, runners ignore this. They say, what is there in a footwear? But I say, invest in the good footwear. Footwear which has a good padding, which absorbs your shocks while running. It takes all the impact and thereby prevents injuries. I can very, very definitely tell you that if you use a good footwear, the injuries around your leg, knee, ankle will be much less as compared to if you use just a regular footwear. So invest in a good footwear. All I can just to give you a comparison, what you might spend for 2 dinners, if you put in a good footwear, that's enough to get you a nice pair of shoes. The next important thing is the surface, the terrain where you run. So of course, when marathons are usually on tar roads, but while training, use some ground. Don't start directly running on a tar road. Use a ground or use other kind of surfaces which are not directly tar road, and start with that. The next is a technique what you use, and there are various techniques. For this, I would say that you should take some advice from a fitness trainer or coaches who will tell you the exact technique of running, because the movement of the hand, how you land, the impact of the heel when you land, when you take the push off, the heel strike, all that is very, very technique and, biomechanically dictated. So I think that is the important thing, and it varies, and you can talk to the expert in that. Then if you have some kind of knee pain, ankle pain, then you should use protective gear. What is that? You can use various kinds of knee braces, knee supports, knee caps. You can wear shin guards if there is a possibility of a stress fracture. Then you can wear something in the anklet, the ankle binders, the ankle braces, or then you can use extra support in your footwear as well. So that is all about the protective gear which you should do. And last but not the least, listen to your body. Your body is signaling you. Your body is telling you, please stop, please stop. And you just, because of your own passion, because of your ego, or because of competition which is coming, you continue to run. in spite of the body signaling you, and then you get the injury, you get the problems which I've enlisted before, and then sometimes it's too late. So listen to your body will tell you a lot, and then you can prevent these injuries. And God forbid you do get an injury, then I would say is early medical help is go to a doctor, go to a sports medicine physician. And we at Sancheti Hospital have a great sports medicine lab. We do a lot of investigations, training to help you to run a good marathon.
Thank you so much, sir. I'm very sure all the information that you have shared with us and our viewers today will really help them get into running as a sport in a right way, so that they don't land up with injuries because of which they have to stop running. So thank you so much once again, sir, for giving us your valuable time.